welcome. This is OET Study Buddy International Network. Today we are talking about OET speaking for doctors. So if you're a doctor, if you're interested in relocation or you need English language testing, you might want to enroll at our OET speaking, our OET Study Buddy program for healthcare professionals. So join us today for the OET speaking for doctors. If you are enrolled and you have not completed your class the portal, please go and attend to your classes in the learning portal, and then you can come back to the video. This is just a revision class or like a warm-up class. So as I've earlier discussed in the class, OET speaking is just conversation between yourself as a doctor and your patient. It could be in form of you talking about examination, an examination you want to conduct, or a diagnosis or treatment, or you are explaining just the course of a particular medication to the patient. So different ways like that. We're going to be talking more about the flow of the communication and some other things you need to pay attention to. So we have these resources that we are using, and I want to encourage you to follow through and practice with Caesar as well. I'm going to start the sharing. Okay. So if you go to your learning portal and the learning resources, speaking resources, you are going to find this particular OET speaking tip. So you have the warm-up questions that you will be asked. So the warm-up questions are not scored, just so you know. They are not scored as part of the exam. Okay. So you're going to be asked those warm-up questions because they want to maybe sometimes trying to help you to relax as well. Okay. And then the role plays are different. We're going to go through that overview of the stages in the consultations. We're going to be talking about the language appropriate to each stage of consultation. You know, the appropriate language. Remember, if you are listening to the previous class, the appropriateness of language as part of the criteria that you will be scored with. All right, then the other different stages of the consultation: greeting, how you introduce yourself, taking a case history, examination, diagnosis, treatment, invitation, and feedback. So, and of course, leave taking when you want to exit and, leave the patient. Okay. So briefly, I'm just going to, take a peek out of all this, and then you can go back and, study in detail. So the first thing there, like I said, are the warm-up questions. All right. So you answer some questions about your background. They can ask you, where are you from? Now, what do you do for a living? They can ask you about your job. What's a typical day like in your place of work, or you share an experience of your profession. So those are kind of warm up. Like I said, they are not scored. Now you have the part two, which is the role play. This is actually the one that will be scored. The candidates receive a role play card in which they receive notes about the patient. So the candidate then acts out as a consultant, like a consultation with the interlocutor who is now your patient, kind of. So that is that. You have two role play cards, okay, for your speaking. So that means you're going to be doing two role play cards. All right. So again, for the warm-up questions, I'm not going to be dwelling much on this because, like I said, it's not scored. But it's important that you rehearse your answers as often as possible, because this will increase your fluency and accuracy. So an icebreaker there, they can ask you, how are you? How do you do? How do you prepare something? They can tell you, can you tell me a little about your study or about your background? They can ask you, have you investigated your profession since you are in your country this time, this like Australia? Do you know what you need to do in order to work in that country? They're just asking you general background question, okay, about your study, your degree, your profession. They can ask you things about your professional plans for the future. if I can expand this. Yeah. So they can ask you so about your professional plan for the future, what do you want to use OET for? Have you any plan to study further and things like that? So remember, like I said, this is not scored. This stage is not assessed, except for some vets, who only have experience in tropical medicine. So, but for veterinary medicine, this will be used. And again, I need to acknowledge that this material, the author of this material is duties given, but it's very, very essential and very good for doctors. So the warm-up area it helps you to also relax your mind and get the feel of the examination. So for yourself, it might be important for you to prepare a reasonable detailed biographic account of the relevant study and work experience so that you're already familiar with what you're going to be talking about. Not like you have to cram, but at least you have an idea. So now let's talk about the stages of the role play for the OET speaking for doctors. So you have the greeting, how you greet the patient, taking the history. So how do you greet a patient? Just it's general. Hello, how are you? My name is Dr. Prince. I'll be looking after you today, or I'm the medical intern on call. I'm the surgical intern on call, or you want to say I'm the senior it's a SHO. SHO is senior health officer, right? So or SMO, whichever way as you call it, senior medical officer here. I'm the consultant. So introduce yourself with the patient and also ask who the patient is or confirm the patient identity. That's the way you go about it. Like you can confirm patient identity by saying, can I confirm your name and date of birth? And the patient says it back to you. Or you can say, can you tell me your name? After that, so okay, confirm the date of birth or check the ID band of the patient. You can also, confirm identity of the patient. For instance, you can tell the patient, like maybe the patient name, you can say, hello, Mrs. Morris, is that right? Is that correct? Or am I correct? So that's for a known relationship. Sometimes for somebody you know before, and the patient knows that you know him or her, and then you're asking, what is your name? Sometimes it sounds rude or it sounds somehow weird. So rather than you saying, what is your name, you can say the patient's name and say, am I right? Just to be sure I'm not mistaken, something like that. Now, take a case history. How do you take a case history? Questioning about the reason for the presentation. Why did they come? What's the nature, the location, the complaint, and so on. So take a case history. You know how you take a case history. But remember, you are timed. So you have 10 minutes for each of the role play card. That means you have 20 for both. So you need to be able to complete the task. So you need to put that in mind. Examination. So are you going to examine this patient? Is there any request you want to, anything imperative, something that you have to instruct the patient to do? Are you talking about diagnosis? So are you making a diagnosis? Are you explaining a diagnosis? You need to be able to check the understanding of the diagnosis, acknowledging patient's reactions of that diagnosis, and then providing the right reassurance. Now, the next stage is treatment, and this is about ordering tests. Maybe you want to order some tests. You are telling the patient you'll be ordering tests like the FBC, creatinine to check the kidney function and all that. Prescribing medicine, that's about treatment as well. Are you prescribing some medicine? What is this medicine? What is it going to, the purpose of it, the mode of action, any side effects? Are you suggesting a treatment plan? Are you suggesting that the patient take up some exercises? Are you advising that the patient stop smoking? Reassuring, you need to be able to provide some reassurance along line as you know, give the treatment plan. Also part of that is informing about possible future outcome that might be applicable and checking back on patient understanding. This is very important. This is very important. Now, the next stage is inviting feedback. You must be able to ask the patient, let the patient ask you questions. Very important. If the patient don't ask you questions, then you can also ask question from what you have said to really establish that the patient understand what you have said. Now, leave taking is the last stage. That is, how do you leave the patient? Do you say, "Oh, I'll see you in the clinic next week"? Or should you, if you need anything, you can always tell any of the nurse, they know how to find me. Or don't forget to mention to anybody if you feel sick. So that is leave taking, leaving the patient with some bit of information of how they can, get help. So emphasis given to different stages will vary according to the nature of the complaint. So again, like I said, you need you to go and study this document properly. All you need for the OET Speaking for Doctor is to follow these stages. Follow these stages as applicable to your case study. All right. This is an example of a greeting for doctor. You want to greet in the first stage or introduction. Hello, what's the name of the patient? If you know the name of the patient, hello, Mr. Namdi. I'm Dr. Prince, one of the doctors in this clinic. That is an introduction. All right. So for the last, I need you to pause and to unmute yourself and introduce yourself or greet this patient. You have the floor there. Hello, Prince.
Can you hear me?
Yeah, I can hear you now. So I need you to introduce yourself using what we just said as we close up today.
Hello, Mrs. Jane. I hope you're doing well. I am Dr. Prince Onyekachi. I'm the senior registrar in this clinic.
Perfect. Thank you very much. That was smooth. That was smooth. Thank you. All right. So, like I said, please go and attend to this. I need you to practice alongside. Now, how do you take history? Of course, you know this already. So the question here about reason for presentation, that's the first thing. So you can say what brought you along in today, what seemed to be the problem. So these are kind of examples of what you can say. So pick the one that flows well with you. Questioning about duration of complaint, those are the kind of things you ask. Questioning about onset of complaint, those are the kind of questions you ask. Where does it hurt? That's the location or more things about the complaint. So taking history continues. So I need you to go and study this and practice with it. So I'm going to be sending you some tasks for the rest of the week, this weekend, so you can practice how consult this patient using the role play, the stages of the role play for OET Speaking for Doctors, which is different from that of the nurses. Question is there examination, diagnosis, acknowledging. How do you acknowledge? How do you reassure a patient? So that these are the examples of things you can say to reassure a patient or to acknowledge their feeling is also very important. How do you tell the patient about the treatment, ordering tests, prescribing, suggesting, maybe you are trying to suggest a treatment plan or an approach. Advising. Now, difference between suggestion and advising, suggestion is more mild. Advising is like stronger than suggestion. So thereabouts, this time you're trying to advise them to cut down fatty food. Why? So every advice must have a why. So you need to support your advice with a why. All right. Reassuring. How do you reassure a patient? Informing, checking. So like this is checking for understanding. Remember I told you that you need to check your patient understanding. So these are the kind of questions you can ask to check for patient understanding? Like, do you feel you understand a bit more about that now? Do you feel a bit better about that now that we've talked about it? That is checking patient understanding. Or do you understand what I just told you about this and this? So you need to be able to be clear. Are you clear about all that? So that's how to check understanding. And then inviting feedback, which is very important. You can ask, do you have any other concerns? Is there anything you would like to clarify? Leave taking. Now, this is the final part that you say, okay, well, don't hesitate to call me if you have any concern. Give me a ring if you are worried. I would like to see you in a week or come back in a fortnight. So you can just say, good, bye-bye for now. See you later. Or take care of yourself. Mind yourself. That's leave taking. All right. So there are some tips here that about tips for speaking. I'll just run through that so you understand and you can also practice along. Make sure that you are the entry point for the role play. Now, this is very important. You need to take charge. You are the doctor. Don't let the patient lead you. You are supposed to lead the conversation. So be the entry point for the role play. It's like, hello, John, how are you? I've got the results of that test you have done, and it shows rather than starting off with questions relating to the patient general medical history. Now, so some people will just come and say, hello, I am Dr. Prince. Where are you from? Do you have any medical history? And they start asking questions. So first of all, you need to introduce, and that entry point is introduce yourself and tell the patient what you're going to be talking about or what the purpose of that consultation. So clarify anything relating to the role play first before you start. I think I've said that. Highlight the important points involved in the role play card. That you remember I talked about chunking and labeling. So this might be part where you have to do some chunking. Today I'm going to be talking to you about this, and this. That is you are chunk, and you can signpost as well ahead, and you can label. Don't apologize for anything during and after the role play. Now this is very important. Most people, because they think that saying, oh, I'm sorry, is a way of empathy. You cannot be you cannot be sorry for what is not wrong. You understand? So don't apologize for anything during or after the role play. It's very important. Even if you make a mistake, don't apologize, because this is a patient, it is not an examiner. So you need to put that in your back of your mind. Maybe you forgot to say something. Don't say, oh, I'm sorry, ma, and then you go, no. You are talking to a patient and you cannot be sorry to a patient in the in the course of an exam. Try to provide some sort of feedback after every clause the patient utters. So if the patient has said something, maybe the patient used some non-verbal cues, some gestures, try to get some feedback, you know. A good strategy is to pick up from the final part of the patient utterance. I repeat it. I said for about 2 weeks. If the patient is saying something, and then you can come back, bring the patient back to repeat what they have said, in case they are losing out. Keep the volume of your voice up. Don't trail off, as this makes you hard to hear. So keep your pitch when you're talking. When you're supposed to calm down or use a low voice, maybe in a case of sharing bad news or something, then you just need to keep a pitch. You don't want them to make you don't want it to be like you lack confidence and you are not performing your tasks well. So you should be assertive enough and use the right voice tone. Now deliver information in chunks. I've said that the better information you give, the less the interlocutor needs to ask questions to push you to give an appropriate language sample. So give more information in chunks. So like I said, chunking means that you are saying, I will talk about this, maybe 5 things. So you can say firstly. So firstly, by the time you say firstly, about the diagnosis, that's it. You have labeled that. Secondly, and then you can say lastly. So you are chunking and then you're labeling at the same time. say the same thing in several ways. So like rephrasing, paraphrasing, like trying to emphasize, this is typical so that you can reinforce your message. It's very important. Spoken language versus written language. There's difference between spoken language and written language. So try to keep it as spoken as possible and simple. You know, an example is you need to get out and get some exercise. That is a spoken. But when you're writing, you can say moderate physical activity is required. That is, you are writing it. But when you are speaking, you need to be more actionable. So speaking comes with more action than writing. So that is important for you to take note. So that's the end of the OET speaking tips for doctors. Again, I'm just going to reiterate, you need to attend the OET e-portal for your class, your sets, and log in with your login details. Or if you are using the folder, the class folder, log in, of course, with your email as well, and attend the class. You can go to the OET speaking resources where you have the questions, different role play cards, and other tips and strategies that might be applicable to you. Remember, like I said, the OET speaking for doctor is different from that of the nurses. If you have any question, and I can take some questions now, and we can discuss for the next 5 minutes. Thank you very much. So welcome once again to the Synergy International Nursing Network, OET Study Buddy with Nurse Koshala. This is OET speaking for doctors. So we're going to be talking a bit about the tips and strategies that makes the OET speaking for doctors peculiar. All right. So pay attention. If you have not signed up for the OET and you're interested in the OET study buddy, make sure you enroll. You can send us an email at info@synergynurse.co.uk or send a message to the WhatsApp number there on the screen. Thank you very much.
My old hometown always felt so pretty. No one's sending postcards from the city. I've been walking downtown every day. Spiders I always try to fit in. When they consume my head, I hate this feeling. I wanna be a paragon, not a villain. I hate the city, but I stay for you. My love's so pretty, and I always knew from the day we met I'll be with you. The first time you said that you love me too. Without you I'm hollowed out, so I packed my things and